you have lower back pain. You have had it for months or years. During the day, you manage, you take pain medication, you do stretches, you try to stay active, but at night, everything changes. At night, your back pain becomes unbearable. You go to bed and your back is screaming. You try to find a comfortable position. You toss and turn. You cannot find a position that does not hurt. You lie there for hours in pain. You finally fall asleep out of exhaustion. But then you wake up in the middle of the night because your back is in agony. You wake up in the morning and your back is even worse than when you went to bed. Your sleep is terrible. Your back pain is terrible. You feel trapped. You feel like you will never sleep well again. But what you do not know is that there is a specific way to sleep with lower back pain. There is a specific positioning and support strategy that can dramatically reduce your pain and dramatically improve your sleep. Today, I want to share with you exactly how to sleep with lower back pain. My name is Dr. Elena, and I have spent the last 2 decades studying the science of sleep and helping people reclaim their health through better rest. Throughout my career, I have worked with thousands of patients who struggled with lower back pain and sleep disruption. Many of them thought that their back pain and their poor sleep were permanent. Many of them thought that they would have to live with pain and poor sleep forever. But what I discovered was that most people with lower back pain can sleep much better by using the right sleeping position and the right support. This is not a miracle cure. This is not going to eliminate your back pain completely, but it can dramatically reduce your pain at night and dramatically improve your sleep quality. This is what I want to share with you today. The key to sleeping with lower back pain is understanding spinal alignment. Your spine has a natural curve. This curve is called the lumbar curve. When you sleep, your spine needs to maintain this natural curve. When your spine is in its natural curve, your muscles are relaxed, your ligaments are relaxed, your nerves are not compressed, your back is comfortable. But when your spine is not in its natural curve, when your spine is twisted or bent, your muscles are tense, your ligaments are stretched, your nerves may be compressed, your back is in pain. So the goal of sleeping with lower back pain is to maintain your spine in its natural curve throughout the night. Different sleeping positions maintain a spinal alignment differently. The best sleeping position for lower back pain is sleeping on your back. When you sleep on your back, your spine can maintain its natural curve. Your weight is distributed evenly along your spine. Your muscles are not stressed. Your ligaments are not stressed. Your nerves are not compressed. This is why sleeping on your back is considered the best position for lower back pain. However, sleeping on your back alone is not enough. You need to add support to maintain your spinal curve. When you sleep on your back, you should place a pillow under your head to support your neck. Your neck should be in a neutral position, not tilted forward or backward. Additionally, and this is very important, you should place a pillow or a lumbar roll under your knees. This pillow under your knees is crucial. When you place a pillow under your knees, you reduce the curve in your lower back. You reduce the stress on your lower back. You reduce your pain. This is why the pillow under the knees is so important. The second best sleeping position for lower back pain is sleeping on your side. When you sleep on your side, your spine can also maintain a relatively neutral position. However, sleeping on your side requires more support than sleeping on your back. When you sleep on your side, you should place a pillow under your head to support your neck. Additionally, you should place a pillow between your knees. This pillow between your knees is crucial. When you place a pillow between your knees, You keep your pelvis level. You prevent your spine from rotating. You reduce stress on your lower back. You reduce your pain. The worst sleeping position for lower back pain is sleeping on your stomach. When you sleep on your stomach, your spine is twisted, your neck is twisted, your lower back is arched, your muscles are stressed, your ligaments are stressed, your nerves may be compressed. This is why sleeping on your stomach is the worst position for lower back pain. If you currently sleep on your stomach, I strongly recommend that you transition to sleeping on your back or on your side. Now, let me tell you about the research that proves how important proper sleep positioning is for lower back pain. A landmark study published in the journal Spine found that sleeping on your back with a pillow under your knees significantly reduced lower back pain compared to other sleeping positions. Another study found that people with lower back pain who used proper sleep positioning reported significantly better sleep quality and less pain upon waking. A third study found that the relationship between sleep posture and lower back pain is significant, with proper spinal alignment during sleep leading to better outcomes. These studies demonstrate that sleep positioning is not just subjective, it has measurable effects on pain and sleep quality. So now that you understand the importance of spinal alignment and the best sleeping positions, let me tell you exactly how to implement this. First, determine your preferred sleeping position. If you currently sleep on your stomach, I recommend transitioning to sleeping on your back or on your side. This transition may take a few weeks. Be patient with yourself. Second, if you sleep on your back, place a pillow under your head and a pillow under your knees. The pillow under your knees is crucial. Third, if you sleep on your side, place a pillow under your head and a pillow between your knees. The pillow between your knees is crucial. Fourth, make sure your mattress is supportive. Your mattress should be firm enough to support your spine, but soft enough to be comfortable. If your mattress is too soft, your spine will sag. If your mattress is too hard, your spine will be stressed. You need a mattress that is just right. Let me tell you about Jennifer. Jennifer is a 48-year-old teacher who came to my office about 18 months ago with a very specific problem. She had lower back pain for over 8 years. During the day, she managed with pain medication and stretching, but at night her back pain was unbearable. She would go to bed and her back would be screaming. She would toss and turn trying to find a comfortable position. She would lie awake for hours in pain. She would finally fall asleep out of exhaustion. But then she would wake up in the middle of the night because her back was in agony. She would wake up in the morning and her back would be even worse. Her sleep was terrible. Her back pain was terrible. She was desperate for help. I asked Jennifer about her sleeping position. She told me that she slept on her stomach. I explained to her that sleeping on her stomach was making her back pain worse. I explained that she needed to transition to sleeping on her back or on her side. I explained that she needed to use proper support pillows. Jennifer was skeptical. She had been sleeping on her stomach for her entire life. She did not think she could change, but she was desperate. She was willing to try. I gave her a detailed plan. First, she should transition to sleeping on her back. Second, she should place a pillow under her head. Third, she should place a pillow under her knees. Fourth, she should make sure her mattress was supportive. Fifth, she should give herself at least 2 to 3 weeks to adjust to the new sleeping position. On the first night, Jennifer tried sleeping on her back with a pillow under her knees. It felt very strange. She was not used to it. She felt uncomfortable. But she noticed something remarkable. Her back pain was less severe than usual. She was able to sleep for longer stretches before waking up. She was able to fall back asleep more easily. She was getting more total sleep. By the second week, Jennifer was adjusting to sleeping on her back. It still felt a bit strange, but it was becoming more comfortable. Her back pain was noticeably less severe. She was waking up fewer times during the night. She was getting 6 to 7 hours of sleep instead of her usual 4 to 5 hours. She was waking up with less back pain. By the fourth week, something remarkable happened. Jennifer came back to my office and told me that she was sleeping much better. She was sleeping on her back with a pillow under her knees. Her back pain at night was significantly reduced. She was sleeping through the night. Most nights she was waking up with much less back pain. She was sleeping 7 to 8 hours per night. She was amazed at the improvement. What is really important to understand is that Jennifer's improvement was not due to any medication or any external intervention. Her improvement was due to proper sleep positioning and proper support. By maintaining her spine in its natural curve, by reducing stress on her lower back, her pain decreased and her sleep improved. This is the power of understanding spinal biomechanics and using this knowledge to improve your sleep. And this is the key insight that I want you to take away from this video. If you have lower back pain and poor sleep, the solution may be as simple as changing your sleeping position and adding proper support. You do not necessarily need medication. You do not necessarily need surgery. You may just need to sleep in a position that maintains your spine in its natural curve. This is something you can do tonight. This is something that can dramatically improve your sleep and reduce your pain. So let me give you a clear action plan that you can start implementing tonight. First, assess your current sleeping position. Are you sleeping on your back, your side, or your stomach? Second, if you are sleeping on your stomach, commit to transitioning to sleeping on your back or on your side. This transition may take a few weeks. Be patient with yourself. Third, if you sleep on your back, place a pillow under your head and a pillow under your knees. The pillow under your knees is crucial. Fourth, if you sleep on your side, place a pillow under your head and a pillow between your knees. The pillow between your knees is crucial. Fifth, assess your mattress. Is it supportive enough? If your mattress is too soft or too old, consider replacing it. Sixth, give yourself at least 2 to 3 weeks to adjust to the new sleeping position. Do not expect immediate perfection. Your body needs time to adapt. Seventh, track your progress. Notice how your back pain changes. Notice how your sleep changes. You should see gradual improvement over time. Now, I have a question for you. What is your current sleeping position? Do you sleep on your back, your side, or your stomach? Have you ever tried using support pillows? I would love to hear your experiences in the comments section below. If you implement this plan and your sleep and pain improve, please come back and let me know. Your comments help me understand what topics are most important to you, and they help other viewers who are struggling with similar issues feel less alone. If you found this information helpful, please hit the like button. It helps the algorithm recommend this video to other people who are struggling with lower back pain and poor sleep. And if you have not subscribed to this channel yet, please do. I release new videos every week about the science of sleep and how to optimize your health. By subscribing, you will never miss a video that could transform your sleep and your life. Thank you so much for watching. I hope that you will implement this plan and experience the same transformation that Jennifer and thousands of my other patients have experienced. Sleep well, and I will see you in the next video. One more thing that I want to emphasize is the importance of consistency. You need to maintain proper sleep positioning every night, not just occasionally. Your body needs consistent support to allow your back to heal and your pain to decrease. If you use proper positioning one night and then go back to your old position the next night, your back will not improve. Consistency is key. Make proper sleep positioning part of your nightly routine. Do it every night. Additionally, I want to emphasize that the transition to a new sleeping position may take time. If you have been sleeping on your stomach for your entire life, your body is used to that position. Transitioning to a new position may feel uncomfortable at first. You may not sleep well for the first few nights. This is normal. Your body needs time to adapt. Do not give up. Keep using the new position. After 2 to 3 weeks, your body will adapt. The new position will feel more comfortable. Your sleep will improve. Another important consideration is the quality of your pillows. Not all pillows are created equal. You need a pillow that properly supports your head and neck. You need a pillow that maintains your neck in a neutral position. If your pillow is too high, your neck will be tilted backward. If your pillow is too low, your neck will be tilted forward. Either way, your neck will be stressed. You need a pillow that is just right. Similarly, you need a pillow or lumbar roll under your knees or between your knees that is the right thickness. If it is too thin, it will not provide enough support. If it is too thick, it will create an awkward angle. You need a pillow that is just right. I also want to address the relationship between lower back pain and sleep. Research has shown that there is a bidirectional relationship between lower back pain and poor sleep. Poor sleep can make your back pain worse. Back pain can make your sleep worse. This creates a vicious cycle. But the good news is that by improving your sleep through proper positioning, you can break this cycle. Better sleep leads to better pain management. Better pain management leads to better sleep. This positive cycle can dramatically improve your quality of life. Finally, I want to remind you that while proper sleep positioning can significantly reduce your lower back pain, it is not a complete cure. You should also consider other interventions like physical therapy, stretching, exercise, and possibly medical treatment. Proper sleep positioning is one important component of a comprehensive approach to managing lower back pain. When you combine proper sleep positioning with other interventions, you will see the best results. Let me also explain in more detail the biomechanics of how different sleeping positions affect your spine. When you sleep on your back, your weight is distributed evenly along your spine. Your spine maintains its natural curve. Your muscles are not stressed. Your ligaments are not stressed. Your intervertebral discs are not compressed unevenly. This is why sleeping on your back is the best position for lower back pain. When you sleep on your side, your weight is distributed along one side of your spine. Your spine maintains a relatively neutral position, but one side of your spine bears more weight than the other. This is why sleeping on your side is acceptable but not ideal. When you sleep on your stomach, your weight is distributed unevenly. Your spine is twisted, your neck is twisted, your lower back is arched. Your intervertebral discs are compressed unevenly, your muscles are stressed, your ligaments are stressed. This is why sleeping on your stomach is the worst position for lower back pain. The role of support pillows is crucial in maintaining proper spinal alignment. When you place a pillow under your knees while sleeping on your back, you reduce the curve in your lower back. This reduces the stress on your lower back muscles and ligaments. This reduces the compression on your intervertebral discs. This reduces your pain. When you place a pillow between your knees while sleeping on your side, you keep your pelvis level. This prevents your spine from rotating. This reduces the uneven distribution of weight along your spine. This reduces your pain. These support pillows are not luxuries. They are essential tools for maintaining proper spinal alignment and reducing pain. The mattress you sleep on is also crucial. A mattress that is too soft will not provide enough support. Your spine will sag. Your back will be stressed. A mattress that is too hard will not conform to your body. Your spine will be stressed. You need a mattress that is firm enough to support your spine, but soft enough to conform to your body and be comfortable. The right mattress can make a huge difference in your sleep quality and your pain levels. One final note is that the transition to a new sleeping position may require some patience and persistence. You may feel awkward or uncomfortable at first. You may not sleep well for the first few nights. But if you persist, if you give your body time to adapt, you will find that the new position becomes more comfortable and your sleep improves. This is a worthwhile investment in your health and your quality of life. Let me also provide some additional practical tips for sleeping with lower back pain. First, consider your sleep environment. Your bedroom should be cool, around 60 to 67 degrees Fahrenheit. A cool environment supports better sleep. Your bedroom should be dark. Use blackout curtains or an eye mask if necessary. Your bedroom should be quiet. Use earplugs or white noise if necessary. When your environment is optimal, it is easier to sleep despite your back pain. Second, consider your pre-sleep routine. About 30 minutes before bed, start preparing your body and mind for sleep. Do some gentle stretching, do some light yoga, practice deep breathing. These activities can help relax your muscles and prepare your body for sleep. They can also help reduce your pain. Third, consider using heat or cold therapy before bed. Some people find that applying heat to their lower back before bed helps relax their muscles and reduce pain. Other people find that applying cold to their lower back helps reduce inflammation and pain. Experiment to see which works better for you. Fourth, consider your daytime activity. Regular exercise and movement during the day can help reduce your lower back pain. However, be careful not to overdo it. Excessive activity during the day can increase your pain at night. Find a balance between activity and rest. Fifth, consider your posture during the day. Poor posture during the day can increase your lower back pain. At night, try to maintain good posture throughout the day. This will reduce stress on your lower back and help you sleep better at night. Sixth, if your back pain is severe or if it is not improving with proper sleep positioning, consider seeing a healthcare provider. A physical therapist can teach you specific exercises to strengthen your back and reduce pain. A doctor can evaluate you for underlying conditions that might be contributing to your pain. There is no shame in seeking professional help. The key takeaway is that proper sleep positioning and support can dramatically improve your sleep quality and reduce your lower back pain. This is something you can implement tonight. This is something that can make a significant difference in your quality of life. Do not accept poor sleep and chronic pain as inevitable. Take action. Implement proper sleep positioning. Use support pillows. Invest in a good mattress. Give your body time to adapt. You will be amazed at the improvement you experience.